We saw the announcement. A lot of people probably learned that you were here, but haven't had a chance to get to meet you yet. Mike Waldrum is the new CEO of Vidant Health, which, of course, is the entire system. Vidant Medical Center is the huge hospital operation here in town, but you're over the entire system now.
Correct.
And so I really wanted to get you in and learn more about that, and so we're happy to have you in our Vidant spotlight this morning. So let's talk about you first. Give us for people who haven't had a chance to get to know you, give us your background.
Well, I'm a physician administrator, been doing healthcare for a long time, started as a night shift orderly, worked my way up, and have always been involved in how healthcare works. So I'm a critical care doctor, also been trained in administration, ran one of the largest hospitals in the country in Birmingham for a bunch of years, and then went to Arizona for a couple years and led the University of Arizona Health Network for a few years before coming to Vidant. It's been great to be in eastern North Carolina.
I think one of the things when you were hired that I heard from so many people that were involved in that process were that we love Mike Waldron, not only the personality and the leadership skill set that you bring to the job, but your background was in working with medical schools. Right. You mentioned Birmingham. I believe UAB right. was part of. Was that the whole system there? Was that?
I was head of UAB Hospital, which
right.
is the large state hospital in Alabama.
Yeah, and then same thing in Arizona. Was there a medical school involved in that operation?
Oh yeah. So in Arizona, the University of Arizona Health Network, which is the system that's affiliated with the University of Arizona. And the School of Medicine, the dean reported to me actually there. So very active in both those institutions in the School of Medicine. And one of our major roles here is supporting the Brody School of Medicine. It's such an important asset to the community and asset to Vidant Health. And our partnership with them is fundamental to our success. In fact, I wear my Brody School of Medicine pin regularly because I have a position there and I'm a proud member of the Brody School of Medicine.
Let's come back to the School of Medicine. I certainly want to talk about the relationship between Vidant and the Brody School of Medicine, which, by the way, is pretty unique, as it turns out, across the country. There's so many medical schools across the country, but there are few that have the kind of relationship that we have here. Most medical schools are involved in where the hospital and the medical school are all under one roof.
Well, actually, the most common model, about 50% of them are arranged like we are.
Is that right?
Where it's a separate nonprofit company. That's what we had in Arizona.
Interesting.
But part of our mission is to support the School of Medicine. And the reason that's been done over time is that states have wanted to spin out the healthcare operations because that's not typically what a lot of states want to be running. Mm-hmm. And a lot of healthcare companies don't want to be part of state because of the encumbrances that come along with being part of a state organization. So over time, about 50% of them have a relationship like ours. So we have an adage, though, in academic medical centers, if you've seen one, you've seen one. They're all a bit unique.
Yeah. I like that. You've seen one, you've seen one. The whole world of medicine has changed so dramatically, and there's so many challenges now. Is it fair to say, though, that Vidant Health has more than most in terms of challenges because of where we live? We have a population that is pretty sick and has a lot of unique medical issues here in eastern North Carolina. And then beyond that, we also live in an area of the state, even though North Carolina is seen now as one of the really progressive states in terms of the economy and those kind of things. We don't live in that part of the state. We live in a part of the state where the economy is very much an issue and struggling, and so people paying their medical bills is a big issue, and so there's a lot of Medicaid here, and of course, as we know, Medicaid is a problem these days. Is it fair to say that Vidant has more issues than most medical operations?
Well, I would first start with, we have a great institution that covers eastern North Carolina. The leadership in the past, the employees, the physicians do great work every day. And I've been here 5 months, and I've spent most of that time out and about across Eastern North Carolina, learning about what we do in our communities and what is it, how do we work. And I describe it as a phenom. It's a phenomenal organization. The fact that we have a 900-bed hospital in a town the size of Greenville and 7 hospitals across Eastern North Carolina, and the relationship with Brody and the Vidant Medical Group and the relationship with the community physicians is a phenomenal story. However, we're in healthcare, and healthcare in 2015 in the United States has been is under huge pressure. And so we've never seen this kind of pressures, especially in academic-related healthcare, because the funding for care delivery is in a period of transformation. And then also there's been a lot of compression on payments for education and for research. So we've seen really all lines of revenue being impacted, and that obviously puts pressure. And then you put the fact that we do live in Eastern North Carolina, which is an absolutely beautiful place. I've loved getting out there. However, it comes with some unique challenges for some of the reasons that you mentioned. And so we've been talking a lot about that since I've been here. And, you know, I think our board and our institution wants to embrace that we are here to promote the health and wellness of Eastern North Carolina. We can't run from that mission. And also we can't run from the fact that we live in Eastern North Carolina and it's rural. And this is a national problem. People are getting out of rural health care in the United States. Just since I've been here, one of the national chains have decided to get out of health care right up the street in Williamston. So it's people are getting out of it. We don't have that opportunity. We're going to embrace it and build a model healthcare delivery system for rural America, transform ourselves. And that has pain associated with it because, as we've seen in some of our communities, if we've looked at moving towards a higher value system of care, that transformation has pain associated with it, political and other types of pain. And then lastly, I would say, Medicaid is in the state of North Carolina is undergoing some significant transformation also in that the legislators have acted, and now we're in process of looking at how we build that to support our communities. We want to engage with the state and with the development of how it will work. We would like Medicaid to be expanded. Most hospital people would. And I'm a fiscal conservative, and the issue I have with not expanding Medicaid is that it's really a hidden tax to the businesses in that we spend $100 million in uncompensated care, and we have to spread that cost to people that are insured, and so kind of don't see that. It's kind of
no such thing as a free lunch.
Right.
Somebody's paying somewhere.
Yeah, it's a hidden thing.
Yeah, that's been one of the toughest issues I think that the state has wrestled with. I know the governor and the legislature have looked at it, and their big concern, of course, you have to tell you, but people who haven't followed it may not know, is that the federal government has said they're going to pay for it for a number of years, but then at some point there's going to be a point where they're not paying for it anymore, and where's that money going to come from? And they're concerned about that. So it's a tough one. And Medicaid is a huge issue in the state budget, as you know. I don't have to tell you. You have other community hospitals. I was just when you walked in this morning, I was telling you about one of my family members who was treated this week in Edenton. I grew up in Chowan County, and I can tell you that the addition of Vidant into these smaller hospitals like Edenton, other places, has increased health care exponentially in some of these communities. But you've also gotten criticism. I mean, under the previous leadership, the Belhaven Hospital was closed, and the mayor of Belhaven has been on a mission to what he say expose the profit motive there, and that Vidant did not handle that well. Now, you came in after that decision was made. Looking back at that, was that the right decision? And what about the current relationship down in Belhaven?
Well, it's been interesting to walk into it, and I think we're concentrating on how to take care of people in communities. One of our strategies is to push healthcare to communities and actually to home, and in this transformational phase to move to value. And So supporting local communities and supporting delivery that's affordable for the amount of services that those communities need is the great challenge. You know, I've been to really all of our communities, met with community leaders, and there is a huge commitment to us and relationship with us in all of those communities. Unfortunately, we don't have that in Belhaven, and the first thing I'd say is we have great professionals down there. Met with our staff last Wednesday night, and you know, we have 30 to 40 staff that go to work every day. There's a line at the door. We're taking care of more patients today than we were when we closed the hospital, and they're good people doing great work, and I hate to see how they're kind of in the middle of this because they're good people taking care of the people in Belhaven. You know, we're concentrating. I do think it was the right decision. You know, it's an unfortunate situation with the size hospital, the amount of patients that it was struggling long before Vidant ever walked into the door. You know, it's been a historical struggle just because of the amount of overhead for the amount of service that was being provided. The math didn't work really, and so we're looking at how do we transform and provide a very high level of service that's affordable for that community. And so we're committed to the citizens, and we're looking forward. And so, you know, we're committed to the point we're putting $6 million of infrastructure down there in Belhaven. And I challenge anybody to look at any company that's a non-governmental company that's gone to Belhaven and put $6 million of infrastructure
no doubt
in their community.
And you made a great point too. I don't want to interrupt you, but you made I think the point should not get lost. The point that you made, which is that you're actually taking care of more people now than you were before.
Yeah, we're taking more, you know, every day. We have access to care 24/7, and then we have our clinics. And so there's a lot of service being provided to the community, and we're very excited to bring to the community for our patients and our staff and physicians to have a state-of-the-art facility with a helipad right out back. I've toured the facility. It will be high and dry the next time the storm comes through. We spent a lot of money to build the property up. And so we're trying to support the community, and we're looking at how do we move forward in a healthy way and to give the folks access to care there that's affordable and sustainable into the long term.
It sounds like a great solution to a difficult problem down there, and I know politics continue to persist on that, and people are benefiting from criticizing you. So I appreciate the effort. I've seen what you folks have done there, and I think it's a terrific solution to that issue down there. Let's get back to Greenville. Vidant Medical Center, one of the most vibrant medical centers in the country. When people come here to Greenville and see what we have at Vidant Medical, they're blown away by it. We have one of the top heart centers in the country, diabetes, and you know what was really missing in the mix here was a new state-of-the-art cancer center, and now that's under construction, and people can see the tower going up right now. Talk about the growth of Vidant Medical Center here in Greenville.
Well, it's you said it. It's a phenomenal story. To look at, and when you take a 900-plus bed hospital, just that alone in any community makes it one of the larger hospitals in the country, I mean, from a percentage-wise. But then you take it in the size community that we have and the amount of service that it provides and the support that it provides to Eastern North Carolina. It's really tremendous and an absolute testament to the previous leaders and the vision of the county to say let's be part of something bigger, a number of years ago. So the growth and so we're concentrating on how we continue on that path and to continue to invigorate the organization. And part of that is this cancer center. So it's a phenomenal place. Unbelievably great things happening every day. And so it's part of our network of care or system of care. So it's hard to talk about it without the other pieces because it's one of the largest transfer hospitals also. So it goes back to the system that we just talked about in Belhaven. We transfer patients that need it to VMC when needed, but we also want to push care towards home. So it's part of this system that we're in process of designing and putting in place. But the institution itself is phenomenal, and the Cancer Center is so important. We have a huge burden of disease and cancer in Eastern North Carolina. People are, because of primarily access to care, diagnosed typically late with cancer. They have a high incidence of cancer, and so the need is extremely large. And having a state-of-the-art facility makes it viable and excellent for our patients and our staff. And I think it's really important. I heard you talking about football, and you know, healthcare is a little bit like football in that really excellent teams want the state-of-the-art facility, and they want to come to a place that's building a system of care that has a state-of-the-art facility in the middle of it. And it's so exciting to be right in the middle of making that happen. And so it'll be a great asset, just similar to what happened with the Heart Center here.
Yeah.
Bring in, you know, incredible professionals to this part of the country that are committed to our type of patients. And so it's just a really exciting time.
Dr. Mike Waldrum, the Chief Executive Officer for Vidant Health, in the studio with us. Let's get back to the relationship with the East Carolina University School of Medicine, the Brody School of Medicine. There's been so much publicity about funding and how the Brody School has been funded and the problems with funding. And a lot of that has to do with some things we've talked about before, lack of Medicaid, patients that can't pay and those kind of things. And the med school doesn't turn people away. And we've got a top-of-the-line medical school here that produces rural health care doctors and primary care doctors, and they stay in North Carolina. I talked to a third-year medical student yesterday from Greensboro, and I said, "Where are you going to practice?" She said, "I'm going to stay in North Carolina." They stay in North Carolina. This medical school has not only been a huge benefit to the economy of Eastern North Carolina, but just an incredible asset to the entire state in terms of what has been done in terms of raising the bar with health care. But the money's been a problem. I mean, there's no doubt. I mean, last year the governor was here and came in and met with us. That was before you got here, but I know that you know, he came in and saw the need to try to help and put a $10 million budget item in that ended up not being recurring, unfortunately, but hopefully will be as we move forward. But the Brody School of Medicine's got funding issues, and I will say that under your leadership, I got to say this with you sitting here, for people who don't know, under your leadership, the relationship between the Brody School of Medicine, East Carolina University, and Vidant Medical Center has never been better. And it is absolutely on the right track to making the med school sustainable for the future and continue the great work that they do. I have to give you a lot of credit for that. Also have to give Brian Floyd,
Brian's done a
the
great
president of Vidant Medical Center, when he stepped in and started working on that project with Chancellor Ballard and Dean Cunningham and others, the dynamic changed, and we have a great relationship now between Vidant and Brody. And I got to thank you for that.
Well, I appreciate it. It's a vital relationship to us. We can't be successful without a healthy school of medicine, and the Brody School of Medicine is vital to us, Vidant Health. And we're also extremely important to them. So we have a partnership there, and it's incumbent on leadership to make partnerships work well. Brian has been an unbelievable leader in many respects, and clearly in that respect, so I agree and appreciate those comments. The East Carolina University Brody School of Medicine is a high-value school of medicine in that the amount of funding that the cost to produce doctors and to produce doctors that stay in Eastern North Carolina is, you know, the funding is one thing, but then if you look at what it actually cost to produce physicians that serve our communities, the value there is extreme. You know, part of my desire to come to Eastern North Carolina was because of the relationship and building on that relationship. And as I mentioned earlier, part of coming was to actually be a member of the Brody School of Medicine. So I don't like divide myself in half when I think about problems. I mean, they have great faculty, they produce great students, and we have to deal with this funding issue, but we also have to look at how we come together in a more meaningful way to provide care and to help educate the future healthcare workforce for a high-value system for rural America. And so we're very aligned on those objectives. So that's also an exciting thing going on.
We're excited that you're here.
Thank you.
We thank you for your commitment, and having gotten to know you, it's been a joy to get to know you and the leadership that you're providing for the most important asset for our economy in Eastern North Carolina is incredible.
Yeah.
We appreciate that.